Hi class, this is Sarah Wilkins for the Module 6 discussion presentations. For this week's prompt, we're talking a little bit about blood pressure. We're talking with our uncle at a reunion. He says he's not sure his doctor knows what she's talking about. He's upset about having to reduce his salt intake, lose weight, and do the 30 minutes of exercise every day. He thinks that his blood pressure is really no big deal, so we're kind of explaining that internal control of blood pressure. So all three of these measures are going to be used to control blood pressure. So reducing the salt intake, losing weight, and the 30 minutes of exercise daily are all for a hypertensive person. And restricting the salt intake, a higher salt intake is going to result in higher amounts of salt in the blood, therefore increasing the load that the kidneys are dealing with in order to prevent water excretion. The higher the water retention, the higher the fluid load, higher the blood pressure. So when it comes to the losing weight, essentially obesity is associated with increased blood flow, vasodilation, cardiac output, and hypertension. Renal sodium retention also increases, which leads to hypertension. So these factors are considered to be responsible for these obesity-related alterations. So these are some things to keep in mind. The 30 minutes of exercise daily. Exercise alone is associated with reducing our systolic and diastolic blood pressure. Additionally, regular physical exercise or activity is going to make our heart stronger. We know that, right? So a stronger heart can pump more blood, and a stronger heart can do this with less effort. So if our heart can work less in order to pump, then the force that's on our arteries is going to decrease, which is going to then lower that blood pressure. So we can kind of see how these three work together. Additionally, one last thing to touch on, hypertension is the prime risk factor for atherosclerosis, which is a blockage of the coronary artery, which is either going to be completely or partially, so exercising can make our heart capable, forming new small coronary arteries, which will prevent complications with this. So that's why these three factors are important, and this is what we will want to explain to our uncle. Hope this all clarifies. Thanks.